These are 5 Medicare coverage myths about skilled nursing facilities that leave Medicare beneficiaries with thousands in unexpected bills. And the most devastating one involves a rule that 70% of Medicare beneficiaries never knew existed. The Medicare 3-day rule requires you to spend at least 3 consecutive nights as an admitted hospital patient before Medicare will cover any care in a skilled nursing facility. Miss this requirement by even 1 day, and you're looking at bills that can exceed $500 per day for rehabilitation care that you thought was covered. But here's where it gets truly shocking. You can spend 5 days in a hospital bed, receive round-the-clock care, undergo multiple procedures, and still not qualify for this coverage. The reason lies in a designation called observation status, a billing category that has turned into a financial nightmare for families across America. Let me tell you about Sarah Mulcahy, a 96-year-old woman who went to the emergency room with severe pain. She stayed in the hospital for 5 days, receiving IV medications and undergoing extensive testing. When she transferred to a skilled nursing facility for 3 months of recovery, her family assumed Medicare would cover the care. They were wrong. Because her hospital stay was classified as observation status rather than inpatient admission, Medicare refused to pay a single dollar toward her $30,000 skilled nursing bill. Sarah's story isn't unique. In 2014 alone, over 633,000 people experienced hospital stays of 3 or more days that were classified as outpatient observation, meaning none of them qualified for Medicare's skilled nursing coverage despite spending the same amount of time in hospital beds as admitted patients. The observation status problem has exploded over the past decade. Between 2007 and 2022, observation visits jumped from 4.8 million to 7.2 million annually. There's been an 88% increase in observation stays exceeding 72 hours, stays that feel exactly like hospital admissions but don't count toward Medicare's 3-day requirement. This creates what I call the roommate paradox. 2 elderly patients can share the same hospital room, receive identical care, stay the same number of days, yet one qualifies for Medicare skilled nursing coverage while the other faces tens of thousands in out-of-pocket costs. The only difference? Their billing status. The financial impact is staggering. If you meet the 3-day requirement, Medicare covers all skilled nursing costs for the first 20 days. That's worth $6,040 based on the average daily rate of $302. From days 21st to 100, you pay $217 per day in coinsurance. But if you don't meet the requirement, you pay everything from day 1. And here's what many don't realize. Even Medicare supplement insurance, also known as Medigap, cannot help you with this gap because the 3-day rule affects Medicare's primary coverage decision, not just the cost sharing. Medicare penalizes hospitals for inpatient admissions that federal contractors later determined should have been observation stays. These reviews happen months or even years after your hospital visit, creating a system where hospitals err on the side of observation status to avoid fraud accusations. Dr. Philip Baloney from Lancaster General Health notes that patients sometimes threaten to leave emergency rooms because they are terrified of the financial consequences of observation status. The 3-day rule itself is a relic of the 1960s healthcare. It was created when most procedures required extended hospital stays and rehabilitation needs were different. Today, medical advances mean many procedures happen on an outpatient basis, yet the coverage rules have not adapted. The average hospital stay has shortened dramatically, while the need for post-acute care has remained constant. Medicare's attempt to clarify the situation actually made it worse. In 2013, they implemented the 2-midnight rule, stating that stays expected to last 2 midnights should be classified as inpatient. Instead of reducing observation stays, the opposite happened. Total outpatient stays increased, while inpatient stays decreased, the exact opposite of what Medicare intended. The human cost extends beyond money. Families make crucial care decisions based on Medicare coverage they believe they have, only to discover after the fact that their loved one's classification changed everything. Some patients delay necessary rehabilitation because they cannot afford it. Others exhaust their life savings paying for care they thought was covered. But here's the first piece of good news in this story. Significant changes are finally happening. A landmark lawsuit called Alexander versus Azar spent over a decade working its way through federal courts. In 2022, the Second Circuit Court of Appeals ruled that Medicare beneficiaries have a constitutional right to appeal observation status decisions. Starting January 1, 2025, Medicare beneficiaries gained new appeal rights. If your hospital stay was reclassified from inpatient to observation, you can now file a retroactive appeal for any stay going back to January 1, 2009. You have until January 2, 2026 to file these appeals. This means if you or your loved one had an observation stay any time in the past 16 years that led to unexpected nursing home bills, you have less than 1 year left to seek a refund. If successful, you may receive refunds for out-of-pocket payments you made to nursing homes. Beginning February 14, 2025, patients can file expedited appeals through quality improvement organizations if they disagree with a hospital's decision to classify them as observation status while they're still in the hospital or shortly after discharge. These appeal rights represent the accumulation of years of advocacy. The Center for Medicare Advocacy, Vermont Legal Aid, and other organizations fought tirelessly alongside individual plaintiffs like Glenda Jimmo, a legally blind woman with a partial leg amputation who was initially denied coverage. Her case established that Medicare must cover skilled care needed to maintain current condition or prevent deterioration, not just care that leads to improvement. Another major change arrives starting January 1, 2026, with the launch of TEAM, the Transforming Episode Accountability Model. This pilot program allows participating hospitals to waive the 3-day rule for 5 specific surgical procedures: lower extremity joint replacement, surgical hip fracture treatment, spinal fusion, coronary artery bypass graft, and major bowel procedures. Critical access hospitals with swing bed arrangements will also receive special considerations under this model. If successful, this could expand to other procedures and hospitals. Meanwhile, over 70% of Medicare beneficiaries are enrolled in programs that can already waive the 3-day requirement. Medicare Advantage plans and accountable care organizations have flexibility to provide skilled nursing coverage without the 3-day rule. As of January 2025, 53.4% of traditional Medicare beneficiaries receive care through ACOs that may waive this requirement. The second myth families believe is that Medicare provides 100 days of skilled nursing coverage. Technically true, but misleading. Coverage ends the moment your doctor determines you no longer need skilled care, even if that's day 15. The average Medicare-funded nursing home stay lasts less than 30 days. Families often plan around 100 days of coverage that they'll never receive. The third myth involves the improvement standard, the belief that you must be getting better to qualify for Medicare coverage. The Jimmo settlement definitively established that Medicare covers skilled services needed to maintain your condition or prevent deterioration, regardless of potential for improvement. This matters enormously for people with chronic conditions like Parkinson's disease, multiple sclerosis, or dementia. So what can families do to protect themselves? First, ask your doctor daily whether you're classified as an inpatient or observation patient and request written confirmation. Your status can change from one day to the next, so daily verification is crucial. If you're told you're on observation status but believe you should be admitted, ask your physician to document the medical necessity for inpatient care. Second, understand that hospitals must now provide written notice if you're on observation status for more than 24 hours. This notice, called the Medicare Outpatient Observation Notice or MOON, explains that your stay doesn't count toward the 3-day requirement. Don't ignore this notice. It's your early warning system. Third, if you need post-hospital care but don't meet the 3-day requirement, explore alternatives. Ask about home health services, which don't require the 3-day rule. Check if you qualify for Medicaid or veterans benefits that might cover nursing home care. Some states have programs that help bridge the gap. You can also contact your state health insurance assistance program, or SHIP, which provides free counseling to help navigate these complex coverage decisions. The Medicare 3-day rule represents a fundamental disconnect between modern healthcare delivery and 1960s coverage rules. While recent legal victories and policy changes offer hope, the rule continues to surprise families with devastating financial consequences. Understanding these coverage myths isn't just about avoiding bills, it's about ensuring your loved ones receive the care they need when they need it most. The fight for reform continues, but for now, knowledge and vigilance remain your best defense against a system that can change your family's financial future with a simple billing designation.